Have you ever wondered why some children with ADHD engage in self-harm behaviors? This complex issue is not one to be taken lightly. It's vital to delve into the potential reasons behind these behaviors and provide appropriate support and interventions. One of the main contributing factors is impulsivity and emotional dysregulation. Children with ADHD often grapple with these challenges, leading them to self-harm as a coping mechanism for intense emotions like frustration, anger, sadness, or anxiety. To combat this, it's crucial to help the child develop healthy coping strategies. This could be anything from deep breathing exercises and mindfulness techniques to simply talking to a trusted adult about their feelings. Sensory sensitivities also play a part. Some children with ADHD are more prone to sensory overload or discomfort. Self-harm behaviors such as scratching or hitting themselves might provide temporary relief from this sensory distress. To counteract this, creating a sensory-friendly environment and providing sensory tools or activities can be beneficial. Fidget toys or weighted blankets are popular choices that help regulate sensory input and reduce the need for self-harm. In some cases, self-harm may be a form of attention-seeking behavior. Children with ADHD may use self-harm to communicate their distress or seek attention. It's pivotal to respond with empathy and understanding, validating the child's feelings while setting clear boundaries around appropriate ways to express emotions. Promoting open communication and providing safe spaces for the child to express their needs and concerns is key. Coexisting mental health conditions can also contribute to self-harm behaviors. Children with ADHD have an increased risk for conditions like depression, anxiety, or trauma-related disorders. Professional assessment and intervention from a mental health professional are necessary in these cases, providing specialized support and treatment tailored to the child's individual needs. Medication side effects are another factor to consider. Certain medications used to manage ADHD symptoms may impact mood, behavior, or emotional regulation, potentially increasing the risk of self-harm. It's important to monitor the child's response to medication and consult with a healthcare provider if there are concerns. Adjustments to medication dosage or type may be necessary to minimize adverse effects. Social and environmental stressors can exacerbate self-harm behaviors in children with ADHD. Issues such as bullying, family conflict, academic pressure, or changes in routine can increase emotional distress. Identifying and addressing these stressors through supportive interventions, such as counseling, social skills training, or family therapy, can provide relief. It's essential to provide positive reinforcement and support for healthy coping behaviors and emotional expression. Praise the child for using adaptive coping strategies, seeking help when needed, and effectively communicating their feelings. Unconditional love and acceptance are paramount, emphasizing that self-harm is not a necessary or effective way to cope with difficulties. Finally, safety planning is a crucial step in managing and preventing self-harm behaviors. Collaborate with the child, family members, and mental health professionals to develop a safety plan. Identify triggers, warning signs, and coping strategies, as well as emergency contacts and resources for crisis intervention. Monitoring the child's well-being closely is a must. In summary, children with ADHD may engage in self-harm due to a variety of factors, including emotional dysregulation, sensory sensitivities, attention-seeking behaviors, coexisting mental health conditions, medication side effects, and social and environmental stressors. It's crucial to understand these factors and provide appropriate interventions, such as emotional coping strategies, sensory tools, open communication, professional mental health support, medication monitoring, addressing underlying stressors, positive reinforcement, and safety planning. Remember, every child is unique, and what works for one may not work for another. The key lies in understanding, patience, and tailored support.